This is Dr. Akash Jain presenting the IVF and pre-implantation genetic testing protocol for reproductive gynecology and infertility in Columbus, Ohio. The IVF process can be summarized into 4 steps. The first is ovarian stimulation to mature multiple eggs that reside within the small follicles of the ovary. This is followed by an egg retrieval procedure. Once the eggs have been retrieved, they are fertilized with sperm and the resulting embryos are cultured in the IVF lab. Traditionally, a single embryo is transferred into the uterus, usually about the 5th day after egg retrieval. However, in our program, we recommend the biopsy of embryos to test them so we can transfer a normal embryo into the uterus. In order to accomplish this, we look at IVF as a 2-part process. The first part is stimulating the ovaries to retrieve eggs and make embryos. Once those embryos are tested, a frozen embryo transfer cycle is performed, which will hopefully result in a pregnancy. Leading into the process, a patient will typically take 1 to 2 weeks of birth control pills. This provides adequate ovarian suppression and also optimal timing for cycle start. Following this, ovarian stimulation begins using fertility medication. This can last an average of about 10 days. A patient can expect to have 3 to 4 visits to the office for ultrasound and blood work to gauge their progress. Sometimes, depending on the complexity of the case, more visits are needed. Our standard protocol involves using a GnRH antagonist to prevent premature ovulation. This is a daily injection that is started approximately day 6 or 7 of ovarian stimulation. Once adequate follicular size has been achieved, a trigger is given, and 2 days later, the egg retrieval is performed under anesthesia. Following the egg retrieval, the eggs are fertilized with sperm, and the resulting single-cell embryos undergo cell division over the next few days to eventually reach the day 5 and sometimes 6 blastocyst embryo stage. The embryo is approximately 200 cells at this time. This is the stage where these embryos will undergo biopsy followed by freezing. Genetic testing of the embryo biopsies takes approximately 6 to 7 days. During this time, a patient will have started birth control pills in preparation for the frozen embryo transfer cycle. The frozen embryo transfer cycle involves taking estrogen pills and coming in approximately day 10 or 11 to see if an adequate lining has been achieved on ultrasound. If so, progesterone supplementation using injections or vaginal inserts has begun, and on the 6th day of progesterone, an embryo transfer is performed. 9 days following transfer, a pregnancy test will hopefully prove positive. As described, this process lasts about an average of 6 weeks, but the middle 3 weeks, the patient does not need to be at the office as everything is handled remotely. Let's talk in more detail about the egg retrieval procedure. This is done in the office in a procedure room next to the IVF lab. Propofol is used to provide IV sedation, and the procedure lasts about 15 to 20 minutes. As you can see in this video, a needle goes through the back of the vaginal wall, into the ovary, and into each ovarian follicle. That is the dark area that you see. The fluid is drained, and hopefully within each follicle, an egg can be achieved. This particular patient appears to have many follicles and was able to produce many eggs. Once the egg is in the IVF lab, it needs to be fertilized. The egg on the left is mature, as seen by the presence of a polar body at approximately 11 o'clock. The egg on the right side of the slide is not mature. Eggs can be fertilized in one of 2 methods. Conventional insemination involves placing 15 to 20,000 washed sperm per egg and letting them incubate overnight to achieve fertilization. For couples dealing with male factor infertility or low sperm morphology, or doing IVF for pre-implantation genetic testing for a specific disease, ICSI, or intracytoplasmic sperm injection, is used, and that is where a single sperm cell is injected into a single egg, as shown in the picture on the lower side of this slide. The day following egg retrieval, embryos resulting from normal fertilization will have a 2PN or 2-pronuclear appearance, as you can see in the picture on the right side. Over the course of the next few days, that single cell will continue to divide, from 2 cells to 4 cells to 8 cells to a compacting morula by day 4, and eventually to a blastocyst embryo by day 5 or 6. The goal is to get as many embryos to develop to the blastocyst stage, to either be frozen or biopsied before they can reach the hatching stage. Most patients in our IVF program are able to achieve a high number of quality blastocyst embryos. However, we do not know which of these embryos is genetically normal or abnormal until we are able to biopsy them. This process entails removing 5 to 10 cells from the trophectoderm of a blastocyst embryo. The cells are then sent for analysis as each embryo is frozen. We use a process called vitrification to freeze our embryos. Vitrification is the preferred method of freezing as it provides rapid cooling up to minus 15,000 degrees Celsius per minute. This allows the embryo to freeze to a glass-like state without ice crystallization and embryo damage. This is an example of an embryo genetics report for a 31-year-old patient. This couple had 11 embryos that were biopsied, and as you can see, 7 of the embryos were normal. This 37-year-old has a history of recurrent pregnancy loss. After undergoing IVF, this couple had 7 embryos that were biopsied, 4 of which were normal, and eventually resulted in a live birth normal pregnancy. Pre-implantation genetic testing is not only used to determine a normal number of chromosomes in an embryo, but also the presence of a specific disease. In this example, this couple had a risk of having a baby with Marfan syndrome based on their genetic history. As you can see in the second column, 2 of the embryos were normal, meaning they did not carry Marfan syndrome. In the next column, both of those embryos are noted to be euploid, or having a correct number of chromosomes. Based on this patient was able to achieve 2 embryos that were genetically normal and did not have the disease in question. In this example, this 42-year-old patient only had 2 normal embryos out of 12. This is mainly due to the patient's age. As women get older, the percent chance that an embryo is normal goes down significantly. The embryo transfer procedure is painless and performed without anesthesia in the procedure room next to the IVF lab. A transfer catheter is placed into the uterus under ultrasound guidance and taken to near the top of the cavity, where an embryo is released using a small amount of media. Our practice follows a single embryo transfer policy. This is especially true when using euploid or genetically tested embryos that are normal. Regardless of age, we only transfer 1 embryo when this process is performed. We look forward to seeing you at the office for a more detailed discussion and consultation regarding the IVF process as it pertains to you. Thank you for listening.